European countries have begun imposing new restrictions on public and private life as they struggle to cope with steep rises in coronavirus infections. The UK, which has Europe's highest pandemic death toll, has unveiled a new three-tier system, closing pubs, gyms and betting shops in the highest risk areas. And the regional government in Northern Ireland has just imposed Europe's harshest second wave lockdown restrictions. The Czech Republic already imposed a state of emergency. Today, new restrictions come into place, closing all schools, bars, restaurants and clubs. And the Netherlands is also returning to partial lockdown, closing restaurants, hotels and cafes for 2 weeks.
It was what the hospitality industry was dreading most, a return to lockdown. From midnight, restaurants, bars and cafes in the Netherlands must shut their doors for 4 weeks. Masks, too, will now be mandatory in indoor public spaces. The government says it was left with little choice in the face of spiralling infection rates. It's a hard message, and the new rules are going to hurt. But it's the only way, because the facts don't lie. We have to be stricter on ourselves and stricter on our behaviour. It's a similar picture at the forefront of Europe's second wave in the Czech Republic. Testing has been ramped up across the country and tighter measures have been enforced. As well as the leisure industries, schools will be shut for 3 weeks. Masks at tram stops, now a must. Officials conceded they may have relaxed rules too quickly in the summer. Maybe I wasn't strong enough in the summer, and I didn't insist on measures to protect us from the second wave. Meanwhile, in France, business owners in the capital threw a cocktail party protest to draw attention to their plight. Bars are in the middle of a 2-week closure that officials hope would stem the rising number of infections. It hasn't, and the public is bracing for new restrictions to be announced. The government needs to put in place strong and powerful measures in line with the economic tragedy that we're facing here and across France. Across Europe, growing infection rates, fresh lockdown measures and the inevitable health and economic hardship to follow is the headache for which there are no easy fixes.
Well, for more, let's bring in DW's Bernd Riegert. He's following this story for us in Brussels. Bernd, talk us through these European traffic lights. How's it supposed to work?
The European traffic light has 4 colors, actually: red for dangerous zones, orange for medium infection rates, and green for countries and regions which are okay, and gray for those countries who don't give the data to the ECDC, the European Centre of Disease Control in Stockholm, that will publish this new map of Europe, not only of the countries but the regions, and this is new, broken down to 200 regions. And the new point is that not only the incidences, so the new infection cases will be rated, but also the number of tests and the positive tests that are returned. So you have a new criteria to apply, and that might change the map a little bit. For example, in Germany, the number 50 incidences is no longer valid. It can now range between 25 to 150 incidences, but you also have to apply the positive return rate of tests, which should hover around 4% and not higher. And all these measures are designed only for tourism travel. Essential travel and urgent business is not afflicted by this, and all these measures are voluntarily, so the member states are not obliged to take part in this new traffic light system.
Okay, well, this system does sound like it could provide some valuable orientation to travelers. How soon could it be put in place?
Well, it could be in place actually next week, because the data are all there, and the ECDC, the European Centre for Disease Control, will publish this on the website reopen.europe.eu, and then everybody can see it. But the measures that follow out of this new map, these new indicators, are also up to the member states, so they can decide if they will put in place a new lockdown, curfews, or the obligation to go into into quarantine. This is all up to the member states.
And while Europe waits on that traffic light scheme, infection numbers continue to rise. What are the main hotspots, Bernd, right now?
Well, according to the newest numbers, and I have to look on this map, on the map here, on my map, it's all Western Europe is mostly affected. So Spain, France, the United Kingdom, which are the current hotspots. Also Belgium here in Brussels. But now the Czech Republic is on the rise, and also the Netherlands again. And you can see also a surge in Bulgaria and Romania. According to this new traffic light system, only Finland and parts of Eastern Germany would be in the green zone. All the rest is orange or red. And the tendency is that the cases are going up, but in a difference to the first wave, mortality, hospitalization, and also excess mortality are fairly lower. But the trend is upwards, and now it's the problem how to flatten the curve again.
Most of Europe, orange or red. Bernd Riegert in Brussels, thanks so much. Well, the United Kingdom has recorded Europe's highest pandemic death toll, and new infections there are growing at an alarming rate, especially in the north of England. Prime Minister Boris Johnson has outlined a three-tier system, reinstating restrictions in high-risk areas. DW's Charlotte Chelson-Pill reports from Liverpool and Manchester.
It's last orders for this pub in the northern English city, Liverpool. After a 3.5-month lockdown earlier this year, pubs and bars here are once again being told to close their doors. New restrictions are coming into place across the north of England, bringing a new wave of darkness for both businesses and customers.
I got very depressed over the shutdown. And I've only started perking up since the pub started opening again. I go out to see my friends, have a couple of beers and chill, you know. It's heartbreaking, really.
It's a place to escape to, if you like. You know, my partner, long-time partner, Elaine, died in April with this COVID. She had health issues. Within 2 weeks, she was gone.
I live by myself. I've got depression and stuff, so we've been support for each other. It does feel as though we're being punished.
Like many landlords here, Connor Foley says even paying rent will become difficult. After days of uncertainty, he thinks the government in London's failing businesses in the north.
I think it's quite disgraceful how they've let people fear the worst without knowing what help they will get, not even speaking to local leaders until the very last minute. I think it's just a horrible way to govern in normal times, never mind when everyone's afraid of what happens next.
But there's no getting away from the case numbers. Liverpool has one of the highest COVID rates in Europe. Alarmingly, the UK now has more hospital admissions than before it went into lockdown in March. And it's inevitable other cities will follow in Liverpool's footsteps.
And before anybody enters the restaurant, we have a temperature gauge, so we'll just check your temperature.
In neighbouring Manchester, award-winning restaurant owner Helen C is doing everything she can to keep her doors open. But she's living every day on a knife edge.
I didn't know whether to order stock for this week, if I'm honest. I didn't know whether to take bookings. I didn't even know whether I should open up or not. You can't operate when things are so uncertain. You don't know whether you're going to be open or closed tomorrow. The lady in red is my grandmother, Lily Kwok, and she opened one of the first Chinese restaurants in Manchester.
Helen and her sisters are third-generation restaurateurs. They're now facing an unprecedented challenge.
We're already struggling, if I'm honest. It's not just me carrying the burden, it's the entire family. That's a lot of pressure. And I don't want to let them down, I don't want to let my customers down. And yet, with the trading conditions, I might have no choice. With every order, we write them a little note. We call them the lockdown letters.
Takeaway boxes are now one of just a few rays of light for restaurateurs like Helen.
We still have a whole lot of life to live and a whole lot of examples to set.
A message of hope to a community holding its breath for more bad news.
Well, those are just some of the latest curbs. Other measures are already in place in several European countries. Spain, for example, has a state of emergency in the Madrid region to enforce a partial lockdown, affecting 4.5 million people. Masks are now mandatory in all public places. France has placed Paris, Marseille and 7 other large cities under maximum virus alert, closing bars, gyms, swimming pools and banning public parties. Cases are also rising rapidly here in Germany. Since Friday, new nightlife restrictions are in effect in the capital, Berlin. Bars must close at 11 p.m, further hitting Berlin's famously liberal nightlife economy. Chancellor Angela Merkel will meet leaders of Germany's federal states shortly to try to solve the confusion around 16 different sets of rules.
The incidence of new coronavirus cases in Germany keeps rising. Every day, new cities join the list of risk areas. Some areas in Germany have surpassed the key threshold of 50 infections per 100,000 inhabitants over the last 7 days, including major cities such as Frankfurt, Berlin, Munich and Cologne. As infections climb, Germany is trying to figure out how to deal with the new upsurge. One problem: the solutions differ all over the country. In Berlin, for example, there are no limitations for travelers from inner German risk areas staying in hotels. There is also no obligation to wear masks on the streets. Another city, another set of rules. In Munich, travelers from designated risk areas can only stay at a hotel if they show a recent negative COVID test. And masks are mandatory in some outdoor areas of the city. The different rules are making it hard for Germans to understand what they can and cannot do.
In essence, no one can really remember the rules. They seem to be pointless, and I don't think they will survive for a long period of time because more and more cities are going beyond the threshold, which is, let's say, the threshold, the alarm threshold, which is in use here. So the policy becomes redundant in a couple of weeks anyway.
But the end of that chaos might be near. The leaders of Germany's 16 federal states arrived in Berlin and are set to meet with Chancellor Angela Merkel for the first non-virtual meeting in months. Some state premiers have already announced they will cling to the accommodation ban, while others want to see it dropped. The question is, will the Chancellor's personal and in-person authority be enough to unify the positions?
I want to put that question to our chief political correspondent, Melinda Crane. Melinda, can the Chancellor wrangle unified measures from all those 16 regional leaders?
I think it's quite likely that she can. She's known as an adept negotiator, and it will definitely make a difference that the state premiers are meeting personally with her for the first time in a number of months. And there is precedent for brokering such an agreement. If we look back to the first wave of corona here in Germany in mid-March, April, there was quite a bit of discrepancy and differences of opinion among the different federal states, but under the watchful eye of the Chancellor at that time, they did manage to agree on a unified approach. And the fact is, there's increasing recognition that the lack of consistency, this patchwork of different rules, does confuse citizens and therefore discourage compliance. So today, we're hearing from two of the most powerful state premiers, the heads of North Rhine-Westphalia on the one hand and Bavaria on the other, whose approaches often differ, that they do now think it is time for a unified set of rules.
Well, infection rates are rising rapidly, really, across the country. Are we going to see a unified approach with tighter restrictions then?
Yes, I think that we will see tighter restrictions, for example, in regard to the wearing of masks, perhaps extending the number of locations where masks must be worn, perhaps also some tighter limits on public gatherings and social events. But that might be paired with at least a partial rollback on controversial measures whose efficacy has been questioned by authorities. And that would certainly include this travel ban that has been imposed by some rural parts of Germany on people coming from hotspots, from bigger cities, requiring them to show a negative corona test before being allowed to stay in local hotels. Authorities say that that doesn't make sense, especially with testing capacity increasingly limited.
Melinda, Germany came out of phase 1 of this pandemic looking rather good. How is it looking for phase 2?
Well, people here are definitely in agreement that this is a decisive moment for the country. Both the government spokesman saying earlier this week that Germany is at the beginning of a second wave and that this now is a crucial moment in time. And the head of Germany's leading coronavirus institute, the Public Health Authority, Robert Koch Institute, says as well that this moment is decisive and what really counts is individual responsibility across the board. So we'll see if that responsibility starts now with this meeting of the state premiers.
Our chief political correspondent, Melinda Crane. Thank you, Melinda.